So I received the first dose of Pfizer on April 3rd. Little did I know this would be the worst day of my life. After an hour, I called 911 due to an anaphylactic reaction.
We've seen entire vaccine programs put on hold for rare cases of thrombosis. Every transfected cell expressing spike protein risks autoimmune disease, the most acute of which is myocarditis. When people started dying of myocarditis, you did nothing.
I would just remind the public that VAERS is a method that captures all adverse events, and causality in VAERS is not established.
The VAERS Federal Vaccine Adverse Event Reporting System. With those statistics, do you agree with me that if they're accurate, they constitute a signal from the system that there could be a problem with these vaccines?
No.
Okay, and why is that?
I think it's more complicated than that.
We just wanted to do the right thing. We were informed the vaccine would be safe, as our entire family and friends were all vaccinated.
There seems to be a lot of misinformation.
We were betrayed and lied to. I had no other choice but to call 911 for help after my Pfizer vaccine.
And I'm saying it right now in real time because I'm watching Twitter storms in front of me about misunderstanding VAERS.
I lost my baby boy. I had nothing else to live for.
They assured me they would not let me die, but I realized they didn't know about adverse reactions.
VAERS, anyone is able to submit an adverse event to VAERS.
It seemed like no one was really prepared to deal with allergic reactions.
We were immunizing 8,000 people a day.
Wow.
And so you got, 10 clerks or something? So
Oh my gosh.
Took us about 6 weeks to catch up.
Wow. It's like, gosh, well, his story just slipped through the cracks. How many people are like him? Is the death rate actually higher after?
And I would say that in all likelihood, it probably is.
We actually require that certain things be submitted to VAERS, and so it can, from casual inspection of VAERS, look like there are things that are associated with the vaccines.
When will the COVID vaccine injured people be acknowledged and treated? None of my physicians have reported my case to VAERS.
DHR Health.
He got vaccinated at DHR Health on 4/19/21. See if there's been an adverse reaction reported too, and if not, we need to start one.
I contacted my doctor almost daily. My heart felt weird. It felt like flutters. I wrote emails for answers to my doctor. No one knew anything. I felt like I was being completely ignored and my symptoms were dismissed.
But until one sorts through that, one does not know what is truly associated with the vaccine.
The animal studies showed heart attacks in pigs after the second injection.
And indeed, we have experts that spend a lot of time and that pride themselves. They work day and night to ensure that they understand the safety profile of these vaccines. That has been done and will continue to be done diligently.
How were the people at the FDA? Did they talk to you at all, really?
No. Nothing at all.
When women started complaining of menstrual problems, you did nothing. Every transfected cell expressing spike protein risks autoimmune disease, the most acute of which is myocarditis. When people started dying of myocarditis, you did nothing.
And as we have findings, as we did with myocarditis, thrombosis thrombocytopenia syndrome, Guillain-Barré syndrome for rare adverse events.
When the vaccinated repeatedly caught COVID and suffered reactivation of herpes, shingles, papillomavirus in unprecedented numbers, you knew this was a massive problem, yet you did nothing.
We will make sure the public knows about them.
You were informed of fraud in the vaccine studies, yet instead of investigating, you colluded with the manufacturers to suppress trial data for 75 years.
I love the hell out of my country, but I don't trust my government anymore.
Everybody on the vaccine committee, have any of them ever received money from the people who make vaccines?
According to the regulations, people who receive royalties are not required to divulge them even on their financial statement, according to the Bayh-Dole Act.
Might also want to figure out how we're going to diagnose myocarditis in very young babies who are unable to speak. Thank you.
This vaccine has injured me and many others, and we need help now, not in 5 years.